He's the writer. Dr. Katherine Pannel, DO and Medical Director of Wright Medical Group. Good morning, ma'am. How are you? It's good to have
Good
you.
morning.
And
Good morning.
May is Mental Health Awareness Month.
It is. We are at the very end of mental health. Yep.
Tell me a little bit about some of the activities and what's going on this month to set it apart from every other month.
Well, and it's funny you say, because I always say that, we should be mental health aware every single day, every single month. But May should be the month in which we really do just celebrate mental health awareness. And every year they have a theme. The theme this year is Take the Moment, and just encourages people to take the moment and have the conversations about mental health. The more we talk about it, the more the stigma falls. Also have a conversation with anybody that you feel like is struggling. So let them know that you're there and that you care and that it's okay not to be okay.
What are we doing in schools? Do we have programs in schools, and are we addressing this? And if we are, how young are we talking about?
Yeah, actually, we recently, last year, passed legislation. It was House Bill 231 that was championed by Representative Creekmore, who's just outstanding for the mental health community. It basically is requiring schools to incorporate a curriculum into incorporate a mental health curriculum into their everyday studies starting in the sixth grade. Primarily focused right now is on substance use because of all the fentanyl issues we're having. But within that, it teaches those kids coping skills, like healthy coping skills, so that they don't want to reach out to substances to learn how to cope.
If you think about it, of course, bullying has always been around in schools.
Sure.
Elementary all the way through high school. But now you have social media and all of these platforms, and it's so prevalent out there. And we've seen lives end in suicide because of that.
Right. There's even a book out now that's outstanding called The Anxious Generation, and it focuses on just that. Bullying has been taken to another level because, back when I was growing up, bullying, it was like a one-on-one thing with you and a couple friends who might bully you, but now it's widespread on social media. You could post things that reach thousands. There's group text messaging where you get more involved, and overall, it's just gotten worse.
Yeah, and the other thing too, and I'm not saying categorically across all of them, but I don't know if moms and or dads are able and equipped to handle this like they were, because you just don't have the family unit. And a lot of times the kids will go home, they get back on the the screen, the parents are on the screen, and we have that disconnect. So mental health awareness needs to be more of a focus today than probably ever in our lifetime.
Absolutely. Parents are the gatekeepers. Kids up until, or not, their brains are not fully developed until their later 20s. Like, we are responsible for helping them grow and develop. And I know parents feel pressure to get devices in the hands of their kids because everybody has a phone, everybody wants Snapchat, but it really is up to us to put those guardrails up to protect our children because they're just not at a point in their maturity where they could do it themselves. They don't see the future ramifications. They're at an age where it's instant gratification.
And every time we think we have, even the parents who are very good at doing this, every time you think you have a grasp of this, something new comes up, like sextortion.
Very true. Yes.
So you have to stay. It's almost like things at the gas station. All of this crap at the gas station. Every time like you have, there's something new.
I know. I always compare it to whack-a-mole. I feel like once we finally have good knowledge and we feel like we're getting something under control, something else new pops up, and we've got to get creative and figure out how to rein it in as well.
Yeah. Haven't had you on since the end of the 2024 session. Anything in the session that you felt like was tremendously successful or needs to be brought back up next year?
Oh, yeah, I got lots. Yeah, so the past two legislative sessions have just been really powerful for mental health care in Mississippi. And again, really led by Representatives Creekmore and Felsher. They have just been true mental health champions. I think the biggest one for me and probably most of my colleagues in mental health was House Bill 1640. Representative Creekmore saw that we have a major problem with housing our mentally ill in jails, and part of that was because of our antiquated commitment process, and this just totally revamped the whole process. Before, it was just, quite frankly, too easy to commit people. You just filed an affidavit, they were gone and picked up by the police and taken to jail to await an evaluation to see if they did need to go and get further treatment. Now that evaluation happens on the front end. When someone feels like they need one of their loved ones or someone else needs to be committed for mental health treatment, somebody from a community mental health center goes out and does that evaluation first to decide, hey, yes, they do need further treatment, which will hopefully reduce the amount of patients that are left in jail seeking treatment.
Yeah, but do we have a place to put them to do that treatment? Because
so
they still wind up in jail.
That is the perfect question to ask, and I appreciate you asking it. While this is a huge, huge step in the right direction, and I do think will reduce how many beds are full, because if you have people that are not needing treatment, they fill up beds. So this process will cut down those that don't need treatment. We can put them back out in the outpatient community and get them treatment that way. But you're right. This is not the end all be all. Ultimately, we are going to have to increase beds so that we have beds available for those patients that are needing treatment. And right now, we're not there.
Dr. Katherine Pannel, from the medical director of DO and medical director. How many of these, Dr. Pannel, are together with the drug situation, or their mental problems are connected to drugs?
You know, I got this question just yesterday at the conference. I would say over 60% are dual diagnosis. It's hard to, I mean, usually it's not just a straight substance abuse issue. You've got mental health issues intertwined with it. It's dual diagnosis.
Is one particular drug?
Well, unfortunately, we're seeing, you know, it used to be that it was prescription pills. We're now seeing things go back to things like heroin and illicit synthetic drugs on the street.
You even have more and more of this information about kratom, and I don't think we addressed that during the session. I know it always comes up, but I don't think kratom was taken care of.
There were several bills to ban it, to schedule it, and they seem to die every year. And I hope to provide some education in the off season, because we've got to get this off the counters.
Yeah. Have you looked at the curriculum as far as those in our schools, from elementary to high school?
The substance abuse curriculum?
Program. Yeah. No,
we are
the mental awareness.
We're actually still in the process. I'm on a task force with it. The Mississippi Public Health Institute has gone through and vetted some curriculums that other states are using, and we're looking at that right now, and going to have a few spots in the state, including Oxford, where I'm from, to give those a trial run. So that's still in the process.
Yeah. How's it going? Is it going to work kind of like career counselors, or is it going to be done by the teachers, or how's it going to work?
It is going to be done by the teachers. It is very interesting. So they'll go in and they'll do like a pre-test. It's anonymous, confidential, with all the students, just trying to see where they were before the curriculum. And then they're going to train the teachers. They're sending in people to train the teachers to administer the curriculum. And then afterwards, they'll do a post-test. And we'll be able to follow some of the numbers and see how successful the curriculum actually is.
Yeah. One of the things that I've been really disappointed at, and I don't think, and myself too, because I don't think we brought it up enough on this program, is because every time I do bring it up, we have people from all over the state will mention this, is I don't think we've spent enough time talking about dyslexia. And sometimes people don't understand that how rampant it is, and you got kids who are going through school not even being tested. They're testing some here and there, but we don't have a test, and it's so prevalent in our schools.
It is, and ironically, my middle child has dyslexia, and throughout kindergarten, we just thought she was that stubborn middle child that didn't want to do sight words, but she was frustrated, anxious, agitated, mad, and finally we got her tested, and it showed that she had dyslexia.
Yeah.
And it can present itself as like a mental health issue almost, with a lot of anger and anxiety. They don't want to go to school. Their self-esteem is poor. And you're right, we're not testing enough. And then once we do finally have a diagnosis, it's really difficult to find those resources in our state.
It is. And it shouldn't be, because they are available. Maybe that's something we can work on in the next session. And I appreciate you so very much. Thank you, ma'am.
Yes. Thank you for having me. I appreciate it.
We have another segment. You got anything else that you wanted to mention?
Sure, I could talk some legislation actually on dyslexia.
All
If
right,
you'll
well,
have me,
we
I'll
got
stick
another segment.
around.
You got it.
Great.
Back with more coming up. All right, you said, and we are back with Dr. Katherine Pannel. You said there was some other legislation you wanted to highlight, so please do.
Just going back to the dyslexia issues that we're having in the state, I think finally we are starting to test more, maybe not enough, but we are. And so we're having more children diagnosed with dyslexia, but we found that the resources were not available once they were diagnosed. As I said, my middle child, Charlotte, she has dyslexia, and we had to send her to a school 25 miles down the road so that she could get in school dyslexia therapy. And I know a lot of people don't have those resources or ability to do that. So we needed to get more therapists in the schools. And Mississippi, unfortunately, was one of the states where they didn't recognize CALT therapists, that's CALT. They're certified academic language therapists that can treat dyslexia. They're very well trained, but we didn't recognize them in Mississippi, and this legislation passed to allow them to be able to treat our kids in Mississippi in the schools.
It's one of those things that leads to a lot of frustration, even for the teachers who think the student is just not paying attention, et cetera, et cetera. And God bless these teachers. They don't want to misdiagnose that. They want to be able to get the best out of that student.
That's right, and they're stretched so thin anyway, and don't have the training to be able to teach someone with dyslexia. So they were also struggling and needing help in these schools, and just increasing the amount of therapists in schools will help tremendously. I mean, anything is better than nothing. Some of these kids are getting no treatment. This way, they will actually get treatment in the schools and not have to be pulled out of the schools to find treatment elsewhere, and it'll just help parents all around too.
What needs to be done next year on this one as far as the session is concerned? Is it a monetary thing to fund this or what?
No, this happened instantaneously. It's just recognizing them now that they can actually go into public schools. Now it's just hiring them and getting them in the schools. Yeah.
Any other bills out there you wanted to mention?
I'm proud of Senator Delano. He was a wonderful force in getting the 988 system, that number printed on the back of college ID cards, so that when college students are struggling, they have that number to remember as a source for treatment, someone that they can reach out to. And then also, I'm very passionate about harm reduction. And so we're doing great things on that. We've now got legislation passed that will allow for organizations now to acquire naloxone and distribute it. Mississippi's done great things to increase access to naloxone. Now it's up to us to find ways to distribute and saturate Mississippi with naloxone. And that was one of the things. If we can get big community organizations that are working to get harm reduction out there, they now can access it and distribute it as well.
I was looking for to do this. I was looking for this story, but we had another story about a big bust with fentanyl, and I think this was like 100 pills, which is enough to kill I don't know how many people, but then again, they always equate it with that. But I mean, it's showing up every single day with bust after bust with fentanyl that we never saw this 10 or 15 years ago.
I know, and I always say, I just don't know that we're going to be able to realistically end the distribution of fentanyl or the supply. That's why we've just really got to hit hard on prevention, and that starts in our schools.
Have you, and this is kind of hard to quantify, but have those strips helped at all? Do we know?
Well, there's not specific. I don't know specifically if this was the reason why, but I will say that we've gotten some exciting news. The health department came out and said that for the second year in a row, our overdose numbers have gone down. So when you look at it and try to figure out what is the reason, I'm sure it's multifactorial. I'm sure that we've helped get naloxone out there, so that's helped save lives of those who've overdosed. But also the fentanyl testing strips have been legalized, so I think a combination of that has really helped with the numbers. I mean, we know harm reduction works. Harm reduction saves lives.
Yeah. It is May is Mental Health Awareness Month. I know that there's some fun runs and things like that at different locations. Yeah. So whenever you have a chance to partake in that, do so. Final thoughts?
Just have the conversations. Keep talking about it because, again, that's how we reduce stigma. We've got to normalize the conversations surrounding mental health. And SuperTalk does a wonderful job of that. I'm always appreciative of y'all having me on to talk about it.
You got it. Thank you for being so active in this, too. I appreciate your your commitment to it. Dr. Katherine Pannel, and we thank you. Always have a great day, ma'am.